This is Radio Health Journal. I'm Reed Pence. This week, why physician suicides are swept under the rug.
We have this reputation as physicians to uphold the white picket fence and the big car and big house, and nobody wants to hear that you've died by suicide or had any pain or personal problems.
Doctors in lethal distress when Radio Health Journal returns.
June is Alzheimer's and Brain Awareness Month. The Alzheimer's Association is encouraging everyone to learn the truth about Alzheimer's. First, Alzheimer's is not normal aging, and with a wide variety of possible symptoms, it's more than just memory loss. The truth is that Alzheimer's disease is fatal, and even though it can't be prevented, cured, or even slowed, early detection matters, according to Ruth Drew, Director of Family and Information Services of the Alzheimer's Association.
An early diagnosis of Alzheimer's allows people living with the disease and their families more time to plan for the future. It also allows these individuals to get the most out of treatments that may address symptoms and help maintain independence longer. They may also be able to participate in a clinical trial to help researchers discover a cure. It's important for people living with Alzheimer's to access care and services early, so they and their families can live the best life possible.
Take time to learn the truth about Alzheimer's disease. Get started at alz.org/truths. That's alz.org/truths.
Doctors are facing an epidemic, one that most Americans are unaware of and that physicians have been reluctant to either acknowledge or confront. Many doctors are depressed. Experts say about 12 to 18% of them, a figure that's actually similar to the rest of us. But depressed doctors often don't get help, and it results in a suicide rate that's between 2 and 5 times higher than the general public.
Actually, we've known that physicians have a high suicide rate since 1858 when it was first reported in England. Now, 158 years later, we actually have done very little to address this.
That's Dr. Pamela Weibel, a physician in Eugene, Oregon, founder of the Ideal Medical Care Movement, and author of the book Physician Suicide Letters Answered.
It's been estimated that we have over 400 physicians per year that we lose by suicide in the United States, and that's considered an underestimate by researchers who are involved in this data collection. Then as far as medical students, maybe 200 plus over the last 2 years. Again, it's hard to know because we're not collecting the data, but if you look at those hard numbers, like 400 physicians per year, that's the equivalent of losing an entire medical school of medical students every year.
Weibel says nearly 1 million patients a year lose their doctors to suicide, and millions more are being treated by doctors who may be teetering on the edge, seriously depressed. But she says rather than addressing it, medicine seems to be intent on covering it up. If a doctor commits suicide, you may never know the truth, according to Dr. Louise Andrew, a physician attorney and founder of MD Mentor, which consults on physician wellness issues.
There is no really secure way to know for sure how many deaths of physicians are due to suicide. And the reason is, of course, that other physicians are the ones who sign death certificates and certify the cause of death. And it's strongly suspected that because, as in all populations, physicians have a certain degree of shame around the subject of physician suicides, that it's very possible that when a colleague dies in a way that looks suspicious but can't be proven, that perhaps the diagnosis code for the cause of death would be made to appear accidental rather than intentional.
So, like, say, a motor vehicle accident after work is labeled as an accident and not a suicide, even though it's one driver in the car running into a tree and could have been a suicide. Also, people jumping from bridges, sometimes they call that an accidental fall, out of a hospital window. It's just unbelievable. Accidental gunshot wound. Both the men I dated in medical school died by suicide, and their families contend that those were accidental overdoses, which is absolutely ridiculous because physicians dose drugs for a living, and so it would be very unusual to have a physician die by an accidental overdose.
In fact, Andrew says doctors' knowledge of drugs and access to them mean their suicide attempts are much more likely to be completed than average. But Weibel says covering up the problem isn't just a medical conspiracy. Society is complicit too.
Doctors are supposed to be the people we go to for safekeeping of our health, and I think it's really hard for people to view doctors as being fallible and having the same flaws and pain and suffering as everyone else, and so there's a little bit of resistance to wanting to look at this. Culturally, we have this reputation as physicians to uphold the white picket fence and the big car and big house, and nobody wants to hear that you've died by suicide or had any pain or personal problems, so I think there's resistance sometimes on the part of patients to see their physicians as human. And then there's resistance majorly on the part of medical institutions that certainly don't want to be blamed as the suicide school or the suicide hospital where everyone jumps from the rooftops. And so you've got, a lot of resistance to telling the truth.
Medical school is where it starts. According to Andrew, suicide has been known for a decade or more as the number 2 cause of death for medical students, and she says it may actually be number 1, given how suicides are often reclassified. Weibel says many students become depressed as a result of the brutal methods of teaching.
The biggest issue is our medical training is full of bullying, abuse, and hazing. It's very militaristic, like maybe how boot camp was 50 years ago or something. I mean, it's just an intense situation with sleep deprivation and name-calling. And if you've never been through medical school, you wouldn't know this, but you feel like you come out on the other end with PTSD. And this is just by the way you're treated by your peers and your instructors, not to mention the fact that you're surrounded by suffering and human death all day long. It's vicarious trauma just by watching, a 3-year-old die. That's hard to do in and of itself. You don't need somebody next to you saying, well, that was stupid. Why did you do that? Are you an idiot? And not be able to sleep for like 3 days because you're on call for 36 hours. It's a barbaric way to train people to be physicians, and it's totally unnecessary.
Then, when medical school is over, there's residency with its 80 to 100-hour weeks. A study published last month in the journal Academic Medicine shows that 35% of medical residents have clinically significant symptoms of depression. Finally, it's on to their own practices. By then, it's clear being a doctor isn't what most of them expected.
What people are telling me is that they've been abused, they've been bullied, they had to work 7 days on in the hospital without sleep, they've been in really unsafe situations, they've watched people perform things that they consider unethical on patients for money, lying on the medical record, all sorts of things that these basically idealistic humanitarians who are very bright come into medicine just wanting to help people, and then they see just really the dark side of humanity, and they see their dreams getting dashed. They now have $300,000 of student debt, and they realize that they're just going to be an assembly line worker practicing assembly line psychiatry or something like that, just throwing pills at people. It's very disheartening.
Practicing medicine has, for many physicians, no longer the joy that brought them into the practice, and a lot more frustration that they did not expect when they entered the practice. And those two things work together to make the practice less fulfilling and to contribute to the epidemic of physician burnout.
Depression can be very treatable, but when doctors are depressed, they face numerous hurdles that keep them from seeking help. First, like many of us, they may not see it in themselves, but that carries special consequences.
Very often, the very first sign is some kind of a physical complaint. However, when the real issue that's causing the physical symptom is a depression, it's often impossible to find the diagnosis, and therefore a physician may not recognize that that's what they're experiencing, and they may also recognize that they're not really being very good at finding out what's wrong with themselves, which gives them a sensation or a feeling of inadequacy and subsequently depression.
Andrew says other doctors in the office may not point out depression either, for similar reasons.
If you are a colleague of a physician who seems to be ill, it's quite often not addressed. You don't go up to that colleague and say, you don't look so good today, because it's kind of an affront to that colleague, him or herself, doesn't already know that there's something wrong with them.
And families, they're not likely to call out their physician's spouse or mom or dad.
In physician families, both the spouse and the children have a special sense about the physician family member that they are put on an elevated level and they are not to be questioned when they do things that may otherwise seem inexplainable, such as, for example, working all the time. A person who's in a primary family relationship with a physician recognizes that this is kind of a special relationship, and therefore you don't want to jeopardize that relationship by risking that you might be asking about something that special family member doesn't want to talk about.
But even if a doctor knows full well that he or she is in trouble and would welcome psychological help, the system may keep them from getting it. Doctors need a license to practice medicine. They need insurance and hospital privileges. And they know that a record of mental illness could jeopardize all of those.
We're not really allowed to get mental health care without a fear of losing our medical license, so that we are suffering in isolation from one another. We're pretending to have the facade with the starched white coat and the fake smile that everything's okay, and we are not able to ask for help. So, doctors after work are maybe drinking or crying themselves to sleep in their pillows or just kind of getting numb.
If a physician should receive a diagnosis of just about any mental condition, they are then almost certainly going to be faced with a dilemma when they go to apply for licensure, for employment, for insurance of various types.
Andrew says that for most of us, it's illegal for a prospective employer to ask if we've ever been treated for a mental illness. That's a provision of the Americans with Disabilities Act. But medical licensure boards routinely ask it anyway. And if a physician who's been treated answers truthfully,
they are then going to be required to come in and basically prove that their mental health condition, which could have happened 25 years ago, in fact, when they were in medical school, for example, is not currently causing them to be impaired. So the fear that they're going to have to face many additional hoops during their licensure quest, and then even if they get through those hoops, then when they look for employment, that their employers may be asking the same types of questions, and their insurers, such as medical malpractice insurers, without which a physician cannot practice medicine in most states, they may be denied insurance, and therefore their career pathway has been terminated by the fact of a mental health diagnosis, which they were honest enough to answer on an application form, even though the question itself is illegal.
Andrew says most states have a physician help program allowing them to say no, they haven't had mental health treatment, even if they have. Those help programs typically require doctors to register and be monitored. But Andrew says most doctors are unaware of those programs, and sometimes the hoops they have to jump through are just too much.
Some of the physicians who have voluntarily put themselves in these programs for pure mental disorders, such as a long past history of depression in remission, or a very stable treated depression, which we know that probably 15% of the population has, is going to end them being treated as if they had a substance abuse disorder and being in monitoring programs, sometimes starting with 90-day inpatient evaluations and monitoring programs that can last for 5 years of drug treatment and drug monitoring when their only infraction, if you will, is that they had a treatable mental health disorder, which is now perfectly stable.
But even if doctors make it past all those hurdles to seek help, they may not get the same treatment as everyone else. Andrew says doctors aren't very comfortable treating other doctors, but other physicians and even patients can play a role in healing depression. Andrew says it may not seem like much, but it can make a difference when you tell your doctor, "I hope you're having a good day, and I appreciate what you do." And despite the magnitude of the problem, Weibel is encouraged. She says we're taking the first step in addressing physician suicides. Finally, we're starting to talk about it. You can find out more about all of our guests through links on our website, radiohealthjournal.net. I'm Reed Pence.
Radio Health Journal returns with medical notes in just a moment.
As Americans, we love to snack. In fact, according to a recent report by Mintel, 94% of Americans snack each day. While 2/3 of us admit to snacking to satisfy a craving, 1/3 are trying to snack on healthier foods. Some foods can meet both needs. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
Fresh grapes are a perfect snack because not only do they taste great, they're healthy too. A bonus is the grapes are ripe and ready to eat when you buy them. And they're a packable snack that you can bring with you when you're out and about.
Grapes from California are also a natural source of antioxidants and other polyphenols and may contribute to heart health. With just 90 calories for a 3/4 cup serving, no fat or cholesterol, and virtually no sodium, fresh grapes are a smart choice. For more information, visit grapesfromcalifornia.com.
Medical notes this week. People who have had a mini stroke have a 1,000 times higher risk of a major stroke soon thereafter compared to the rest of us. But a study in the journal The Lancet shows that taking aspirin right away can cut the risk of a major stroke in the next few weeks by as much as 80%. Symptoms of a mini stroke, also known as a transient ischemic attack or TIA, are similar to those of a major stroke, but people who have a mini stroke often do nothing about it. Researchers say they should take aspirin and seek medical help immediately. People who are overweight are at a higher risk of several kinds of cancer, but once people are diagnosed with cancer, the overweight may have a better chance of survival. Colon cancer is the latest example, according to a study in the journal JAMA Oncology. It shows that among people diagnosed with colon cancer, those who are overweight but not obese are 55% less likely to die from it compared to normal weight patients. Researchers can't explain why the paradox occurs. And finally, potatoes have a lot of things going for them. For example, they're high in potassium. But a new study in the journal BMJ finds that too many potatoes can raise your risk of high blood pressure almost any way they're prepared. Eating 4 or more servings of baked, boiled, or mashed potatoes per week raises the risk of high blood pressure by 11%, while fried potatoes increase the risk by 17%. But you can eat potato chips. They didn't raise the risk at all. And that's Medical Notes this week. More in a moment.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.